Welcome all to a special meeting of the El Centro City Council, primarily for the purpose of providing our community an update on our coronavirus pandemic and efforts being made by both the County of Imperial as well as the City of El Centro. But there's also some regular business that came up that we also have to take care of that as financing authority. So let's go ahead and get started, please. I will do roll call.
Councilmember Garcia.
Present.
Councilmember Oliva.
Present.
Mayor Pro Tem Jackson.
Here.
Councilmember Villegas Walker. Mayor Silva.
Present. Ms. Walker, you lead us in the invocation, please, and Mr. Garcia, you lead us in the pledge.
Absolutely.
Please begin.
I pledge allegiance to the flag of the United States of America and to the republic of the nation under God, indivisible, with liberty and justice for all. If you could please remain standing and bow your heads. Heavenly Father, we come to you again at the start of this meeting, seeking thy guidance and wisdom as we continue to address this, the challenges put forward by this terrible pandemic that is affecting so many people. In addition to a request for guidance and wisdom as we lead this community forward, we ask for a prayer of comfort and strength for every family that has been touched with the sickness or death of a loved one. Please pour out your peace and your grace and your mercy upon those families and their friends. And finally, Heavenly Father, give us the strength to look for the silver lining and to be forward thinking as we know that we will get through this. We'll get through this together. We'll get through this with your guidance. And all of these things we pray in thy precious name. Amen.
Thank you, Ms. Walker, for that. And I think it's noted that Councilmember Jackson is joining us by phone today. So thank you, Jason, for joining us. Also, I just got a message that Dr. Edwards is running a little behind. As of a few minutes ago, the Senate committee meeting was still going on, so he will join us as soon as he can. Let's go ahead and look at the consent agenda for our City Council matter. Items 1 and 2 regarding the ECRC waiver and forbearance agreement. To have and also the approval of the 6th Amendment to the amended and restated Master Management Agreement between the City of El Centro, California, on behalf of the El Centro Regional Medical Center and the Regents of the University of California on behalf of the UC San Diego Health System. Both of these matters have been discussed previously with Council, but we do need a formal approval of this, so I'm looking for a motion to approve items 1 and 2, or unless any Council member has any questions.
I'll make a motion.
Do we do it electronically, Norma, or?
You can do it electronically, yes.
Electronically? So, Jason, we're going to do it electronically. Oh, wait, how is Jason going to do it?
Oh, I can do it for him right here. I'm already doing it. It's done.
Okay, so I have a motion by Walker, second by Oliva.
It passes 5-0.
And the matter passes 5-0. Thank you for that. We also have to recess as the El Centro City Council, adjourn as the El Centro Financing Authority to take the same action. We have an agenda for that, right?
Same action.
If you look at in your packet, there's an agenda for the Financing Authority, and that is the same item that we just approved as a council regarding the ACRMC waiver and forbearance agreement. And I'm looking for a motion to approve that item as
By roll call, please.
So moved.
By roll call.
Second.
Oh, let's do both. We have a motion by Jackson, second by Garcia. Roll call, please.
Councilmember Garcia.
Yes.
Councilmember Oliva.
Yes.
Councilmember Villegas Walker.
Yes.
Mayor Pro Tem Jackson.
Yes.
Mayor Silva.
Yes, thank you. Still staying with the Financing Authority. Any member of the public that wishes to provide comments to the Financing Authority? Seeing none, I will close public comments and adjourn back as City Council. The primary intent of the meeting today is to provide our community with an update on COVID efforts. As I indicated, I think that about 3 weeks ago when we were having our regular meetings, things look positive. Things look like they were heading in a direction that we anticipated, being able to expand our opening status to high risk perhaps. And then things have kind of gone south on us, and us,
No pun intended.
no pun intended, yes, thank you, have gone the wrong way for us. And we have not been able to reopen our economy as some of us hoped. I think that a message that I continue to provide to our community is that all of us here, and I believe that every elected official in Imperial County want to open, but we want to open it in a responsible way with a mechanism and processes and expectations that are going to keep our community safe, are going to keep our people safe, that our hospital have the capacity to continue to provide services. And we're not there yet. And so we decided to have another update because I think that the response from our community was such that they felt value, they saw value in these meetings. It's an opportunity for our community also to ask questions directly. So we're going to be hearing from a number of people today, our safety officers primarily, and Dr. Edward, our hospital CEO, will be joining us soon. Let's go ahead and get started. Let's go ahead and start with Chief Herbert. Chief.
Good afternoon, Honorable Mayor and Council members. I'm going to immediately introduce Brandon Walls, the AMR Supervisor. We have had the great fortune of working closely with him over the past year. Just a reminder that his office is actually located within our fire department headquarters. And particularly during the responses pandemic, the relationship has been great to have him included in our daily staff briefings as we're discussing situational awareness and operational objectives. So with that, I'm going to go ahead and bring him forward. Thank you.
Thank you, Chief.
Thank you, Chief Herbert. Mr. Mayor, fellow council, pleasure. Thank you for allowing me to come stand before you today. AMR has been standing strong in this community along with the other first responders within this community battling this COVID response. As you well noted, probably around the end of March, we started seeing an uptick in COVID responses, and they have continued to climb ever since. We have seen as many as 20 to 30 a day on the transport side. Keep in mind, every day we have our first responders from the fire departments, police departments. We have our EMTs and paramedics working tirelessly to provide service to these citizens amongst 110, 111 degree temperature every day. So I urge everyone to please stop and thank those folks because they're working very hard, and we're very thankful for them. I represent Global Medical Response, which is the parent company of American Medical Response, and also Reach Air Medical Services. So I'll be talking about both services today. Early on in April, we brought in 2 strike teams at the state's request. It was about 20 personnel and 10 ambulances, both at 2 different times. Those are helped to offset the surge in call volume. Additionally, it also helped to decompress the local hospitals. And that's when we started seeing transfers going farther away. We started seeing them go to Orange County. We started seeing them going up to Riverside County. As many ones paying attention today have been affected by that. At the end of, in May, we brought in a field medical site, state of California. We currently have 6 personnel assigned to that, and we're seeing about 4 transports a day to help support the COVID mission here in Imperial County. It's my understanding there's been approximately 117 patients go through the field medical site today. We've seen as much as 20 per at one time. Additionally, we have extra staff members from San Diego here to help offset some of our staffing as well. We too have been impacted at AMR by the COVID-19 pandemic. We have several employees who are infected with COVID-19, and they've sought care locally, and they've been treated very well, so thank you for that. On the air side, as you all know, much like the ground, we saw an increase in air responses. We're taking patients to San Francisco, we're taking patients to Oakland, we're taking them to the Central Valley, and as you can imagine, that is a big impact to families. I'm happy to tell you that we're also repatriating patients from those areas. The state's involved, and it's going very, very well. But like Chief Herbert said, we are heavily involved in El Centro's EOC.
Sorry, can I ask you to get closer to the mic? I think there's troubles, difficulties hearing you. Thank you.
Chief Herbert said we're heavily involved in El Centro's EOC. Day-to-day operations, we meet every day to talk about the city of El Centro. We talk about the needs of El Centro. We talk about the direction El Centro is going and what can we do to help. And without that partnership, things I feel will be a lot different. And I want to thank you all for being very supportive to AMR, to REACH, and to the city of to the El Centro Fire Department, allowing us to have that partnership. I don't have anything further. I'm happy to take any questions you may have.
Thank you so much for being here, and I'm going to bring it back to council to see if there's any questions or comments. Mr. Oliva?
I just have a comment just to say thank you for the services that you're providing and getting our folks to and from either their homes to the hospital or either transporting them elsewhere. I know that that's probably not the most ideal for some families, but it's ideal for the patient, right? And so I thank you for the service that you're providing.
Could you talk a little bit about how your personnel are responding to 911 calls? I mean, do they know in advance that they may be rolling to a COVID positive site? And if so, do you have access to enough PPE? Is there anything else that we need to be advocating for you in terms of supplies or anything along that way?
Thank you for asking the question. So when we get the initial response, the El Centro, in the city of El Centro Police Department's dispatch, they ask very specific questions. That information is in return relayed to the fire department and also is relayed to us. That's very helpful. It's keeping our folks safe. So that is being done, and we're very thankful for that. As far as PPE, we have a lot of PPE. We've been very thankful that we have a large network under the AMR's umbrella, and also with the help and support of the MOAC program here in Imperial County. Additionally, we are rolling out PAPRs, which is the positive, I don't know what it stands for, but it's the big suits with air that blows into the hood to keep our providers safer. So we've done training, we've done checkoffs, and so we will be rolling that out hopefully by the end of the week so our providers have an additional layer of protection.
So and what kind of sparked that question was when you talked about the number of personnel that are actually COVID positive. Mm-hmm. I'm wondering, were these folks that were diagnosed earlier on, or are you continuing to see that occurring? Or, because in my mind, I would kind of hope we would see a downward slope as the information is being relayed to you effectively. Mm-hmm. And you have access to PPE, but maybe that's a false assumption.
So after every COVID positive transport, mm-hmm. we are informed on the backside by the hospitals, and we do immediate follow-up with our personnel to ensure that proper protective measures were taken. Up to this day, there's been no reports of breach in PPE. So our personnel, we don't know if they're catching it at work or if they're catching it when they're off.
Got it.
Early on, we informed all of our personnel to be very cautious and to treat every patient as if they're COVID positive for their own protection. And that's even when they're off duty and they're going to the grocery stores, wear a mask, wash your hands, social distancing, use hand sanitizer, etc.
Okay. Thank you.
Thank you so much. Mr. Garcia?
Thank you very much for all the diligent work that you've been doing out here. It's definitely been noticed, and we're glad that you're here helping us as part of the team. It must be very difficult for the people that are dealing with this on a day-to-day basis, but it's very, much appreciated by the family and the city. Thank you.
Thank you. We're very honored to be a part of this team.
Thank you, Mr. Garcia. Mr. Jackson, any questions or comments?
Just a quick comment that, I know in speaking with Chief Herbert that he has mentioned many times to the council the value of the partnership between you and the city of El Centro. So I very much appreciate that partnership and thank you for your service to the residents of El Centro.
Thank you. It's our honor.
Thank you, Mr. Jackson. Again, same thing. A question I had that Ms. Walker asked was, what can we as a city do to continue to support you, and the relationship that you have with our police, our fire department, and Chief Herbert, I think is one that those things will come just naturally because we have a tremendous partnership. And it's been a difficult 4 months, but I think it's been an even more difficult last couple of weeks. I think that we all have appreciated ambulance services and hospital services, but that appreciation has elevated to something that it's much bigger than before. And now, when I see an ambulance with the flashing lights on, I think both about the patient that may be there and also the first responders that are there with them, and hoping that that you all stay safe. So our appreciation to you, very, very much. And I think you heard that from everybody.
Thank you, Mr. Mayor.
Thank you. Thank you.
Thank you.
Okay. I'll try to be as brief as possible with this. So this is actually a slide that I took from a presentation on 5/1, okay? And we talked about the need for collaboration with local healthcare professionals, and we talked about data, right? And I know we're hearing a lot about that recently as well, okay? Because what it comes down to at the end is, are we able to provide care for the community, right? When you're analyzing different data sets. By the end of this, I'm going to figure out which button to push. So data, just quick on data, right? So we look at hospital and ICU capacity, and that's key, right? And if anyone's been watching the governor over the last few days, you'll notice that they're kind of zeroing in on that, if you will. Thank you. This is not any less confusing for me, but I'll do my best. But data also comes from contact tracing. It would allow for a deeper dive into local conditions to be able to answer questions about what specifically within our community is contributing to spread. So what we need is a higher level of transparency in that data to allow us to focus our efforts and resources in a more targeted fashion. So we are not there yet locally, but we need to get there. Okay. This is a chart that you'll see from the county's dashboard. They have two dashboards that they maintain. This one is the Roadmap to Recovery dashboard. We've seen or heard a lot about percentages, us being around 23 point something, right? But as of this morning, this is the information presented on the county's dashboard that we're at during that 7-day period, just over 14%. Looking backwards on this, and I've got the question, right? Where does 23% come from? So if you look at those timeframes with the updated numbers plugged into those timeframes, this is, and I rounded, of course, but our highest has been 18%, and then now we're down to 14. So I believe the 23% is a week and a half to 2 weeks old prior to the dates listed on the screen.
And Chief, just because we throw this 8% number around so much, can you just be really specific on what you're talking about in terms of that calculation? For those of us that struggle with math to begin with, can you tell us how that number is calculated and why it's important?
So the 7-day percentage looks at the total number of tests, and it's a test positivity. So divided into, or the number of positives divided by the total number of tests for that given day. So then when you total, if you put those into rows and then you total that column, then you'll arrive at the percentage for that 7 days.
Okay.
The 8% that we're shooting for is identified as a trigger point to move further on into the reopening.
And that's the governor, that's the state's mandate, right? I mean, that's the state's target.
That's correct.
Okay.
So, Chief, can you say there, so I think related to that question, so it's not an 8% average of the last days cumulative, right? It's an average of each of the 7 days.
So the great question. You got me there. So initially, when the numbers were being reported, it was actually an average of the averages.
Uh-huh.
Okay, but that has been updated, so now it's an average of the total.
The total, okay.
Which seems the appropriate way to do it, because if you had, 3 times the volume one day, then that one day on the average of average would really affect those numbers. So for the last week, it's been
Okay.
done by the
So
totals.
this is a more realistic number, I think, in terms of being able to analyze the data, because the other number didn't make sense to me.
I would totally agree with that statement, sir.
Yeah.
But the governor, I mean, to get back to your point, maybe you're going to cover it later, the governor, during his press conference, calling out Imperial County specifically on Friday, the number that I heard him refer to was 23%.
Correct.
So that was old data or based on, yeah, okay. But
So my belief on this
Yeah.
is that number was a published number prior to the dates shown here. So it would be a week and a half to 2 weeks old when we hit that 23% mark. I remember seeing it on the dashboard. I didn't capture it at that time, but again, the period from June 10th through 16th is the earliest that I've been tracking. You can see the percentages accordingly. So I'm sure that the council has all seen the press release that the county put out, right? Regarding the potential, I guess let's call it potential rollback, or the need to make adjustments. So moving forward, what the county is proposing is reiteration of the stay-at-home orders, encouraging business to enforce face covering requirements, closing non-essential businesses to in-store traffic, allowing curbside only, increase educational activity with restaurants, further clarifying curbside pickup, and strongly encouraging families to limit the number of people visiting a store to one family per each visit. Prohibit non-essential gatherings of any size. Continue encouraging faith-based organizations to conduct services virtually. Using outdoor services up to 100. Hope they start those early in the morning. Encourage telecommuting services as much as possible for businesses. Closure of parks and recreation areas, and encouraging the cities to close their parks as well. Continue collaboration to increase targeted engagement with local cities and law enforcement agencies regarding local health orders. So that would be an enforcement component. Additional engagement of community-based organizations and faith-based for a reinvented outreach plan, and continued binational partnership with Mexicali to mitigate impacts of COVID-19 in both communities. This is just a press release continued. The county is waiting for a response on this. It is anticipated that we could see a revised public health order by Dr. Stephen Monday. And a quote from Chairman Plancarte regarding the commitment to diminishing the impacts of COVID-19.
Chief, can you go back to a couple of slides prior? So I think we understand this, but I think maybe for the public we need to make this really clear. These are not new restrictions being placed by the county. These are being proposed by the county. So there's no official implementation of these restrictions, because the official mechanism for restrictions need to come from the public health officer through an order from him, from Dr. Monday, correct?
That is correct, sir.
Because I did get calls yesterday from retailers wanting to know if they should close, and the answer was no, because you need to see the official order from the county public health department requiring that you close your business. So these are being proposed and they're being discussed with the county, with the state. And at some point in time, we may or may not see these additional measures being implemented.
That's correct.
And could I ask two questions? Could you get to the bullet points here, reiterate stay-at-home order? There we go. Okay, the third bullet point down, close all non-essential businesses to in-store traffic, allowing curbside pickup only. That's a little bit of a twist as to where we were in phase one, correct? I mean, at that point, it was, if you were a non-essential business, you were closed, period.
That's
and you
correct.
were not allowed curbside. But this would allow pretty much all retail businesses to continue with curbside pickup,
Correct.
correct?
Correct.
Okay.
So it gets a little confusing, and you almost need a playbook to follow, right? Because
Right.
the guidance and the roadmap has changed,
Right.
at the state level so many times. So
Well, and there's just so much conflicting. It's like every day something different comes out, and it doesn't help that, and we've all talked about this, that San Diego is doing something slightly different, Riverside County slightly different, Arizona's different, and then obviously what's happening in Mexico is a little bit different. The next slide, and maybe this is something I'd like both you and Chief Johnson to comment on a little bit. Of the entire press release, the one that stood out to me was encouraging cities to close their parks. I mean, that's obviously something that this council is going to have to weigh in on. And, I see people out at Buckland Park every day. But from my observation, what I see is folks doing the walking, and every once in a while I'll see a group of typically young teenage boys playing soccer or something like that. But for us to consider closing our parks, we need to know if we really perceive that to be a problem, or are people behaving responsibly, and or if we leave them open, can we encourage, enforce, coerce something so that we can keep those parks open? So, just putting that out there.
thank you.
The one that caught my attention as well is the first bullet of this is prohibiting non-essential gatherings of any size. I'm not sure what that does. That mean at home you can't? You should not be having people at home. And if that's the case, how do you really enforce that? You go out there and you evacuate people forcibly. Chief, you can talk about this later, Chief. But I don't know how the enforcement piece of that can take place.
Where when I read that, I thought, is that being proposed because contact tracing has identified that as a key component to our increased numbers? So it seems to me that a lot of these decisions, if they're truly going to be data-driven, we need to understand what that contact tracing information is providing in terms of the spread, right?
Absolutely.
So to prohibit non-essential gatherings, getting back to the mayor's point, that would be a good thing to do if contact tracing told us that that's actually an issue for us.
Absolutely. And you could extend that to retail shopping.
Exactly.
Right? Why close retail shopping unless we have evidence that,
Right.
it's been the subject of, for
Right.
example. So yeah, early on, the governor was talking about an army of contact tracers being trained, right? So, my opinion standing here is that locally we don't have the data. We don't have the deep dive into the data to be able to answer the questions of, is there an outbreak tied to a certain event that was held? Is there an outbreak tied to a certain location? What location or setting was that in? And I absolutely agree that we need to make data-driven decisions, but first we need the data in order to do so.
So what's the lag time? How much longer before we can actually reasonably rely on the reporting so that we can make these kinds of decisions?
I don't have the answer to that.
You know, some of the points that were made to our state guests on Saturday was the issue of providing resources for contact tracing. And we also heard in a call that the state had difficulty in hiring people and getting people through their, I'm going to call it certification process, you know, that makes someone a contact tracer. So a question I asked is, what does it take for someone to be recognized as a contact tracer? And it's 20 hours of training that they do online, and I guess there may be some exams, some way of proving that they understood the information. And you know, a point that I made is if the state is looking to hire 10,000 of these individuals, you know, let us hire some of our own. Have the county or have the state or have some organization that is going to hire them and do local recruitment. Right? And we can find 40 people that can, more than 40 people that can pass that certification test. You know, to me, that just makes sense. And I don't know if there's, you know, obstacles along that way, but I have made that point that hire them locally.
Well, think of all of the college-bound students or the college-age students who are currently home. I mean, I agree. It seems to me that if we had a call to action, we would readily get that number of volunteers.
Well, I'm talking about hiring them.
Oh, absolutely.
Hiring them.
Absolutely. So I think the people are out there. We just need, who's responsible for that?
The contact tracing falls on the county public health department. So I'm just sharing with you what the state roadmap is, right? We're in stage 2A, if you will. 2A is lower risk. The lower risk workplaces. This is, you know, as of today, we're open to retail, manufacturing, offices, but no limited personal services, right? Churches today, right, they were allowed to open on May 26th. This was based on the California Department of Public Health guidance and approval of the local health officer. It does require modification of 25% or 100 persons, whichever number is lower. And this can be reevaluated and amended by the health officer. This information is taken directly from Imperial County Public Health Department's website. Retail, basically the same, right, was allowed to open on the 26th. Stay-at-home order has remained in effect, but it does allow for the reopening that we have seen, right, for work, for local shopping and such. Dine-in restaurants and personal care have not been authorized in Imperial County, right, so your hair salons, barber shops, and nail salons, we have not moved into that phase of reopening. So what are our next steps?
So Chief, can you go back one
Yes.
slide? So I just found it a little bit interesting that on the governor's order for bars to close, and he identified 7 counties where those bars were ordered to close. Imperial County was one of them, right? And our bars aren't open.
But not legally, so.
That's true.
Not that we're aware of.
That's a good point. And then apparently several other, well, I'm not going to say several, but other counties have decided to voluntarily issue the order to close their bars as well.
And if I may, Mr. Mayor, I believe there was a press conference with the mayor, with the governor yesterday, and somebody did point out the question of what if there's an establishment, a restaurant that has a bar but also serves as a restaurant, and they would like to remain open in order to do the takeout, and the clarification was that they are exempt from that closure if they're able to still provide food, but just cut out the sales of alcohol for the purposes of not gathering folks and things of that nature. Am I correct on that?
Yeah, the statement was to the effect that if the business establishment is primarily for the purpose of drinking, then those were the bars that would not be allowed to remain open. But if it were attached to an eating facility or restaurant, then those would. So that, and again, that's for the folks watching that's outside of Imperial County.
Thank you.
Next steps, right? So we're awaiting to see if the health officer updates the orders. There is a potential for state intervention that's been alluded to in the press conferences. I'm a strong proponent for data. We need to get a deeper dive, get more clarity as to what the picture is. And then, for now, we can continue messaging for the protection of public health, right? And these are the basics that we have all heard and we can all recite, right? For personal hygiene, wearing a face cover, and maintaining physical distancing. And I'll leave on this slide just reminding people to use trusted sources of information as listed, and the City of El Centro info line remains available.
Hey, Chief,
Yes, sir.
one of the suggestions that I keep hearing from people in asking us, the City of El Centro, to take action is the closing of the border, right? And I keep reminding people that the City of El Centro has absolutely no jurisdiction over the closing of the border or the travel restrictions. Those are set by under federal orders. And, I got a call yesterday from someone that said, you guys need to close the border. Well, we can't.
Correct. We don't have the authority to do so. And, I'm going to turn this back to data as well, is that, people make assumptions. And there's a strong assumption about where cases are coming into the county. Where's the data that backs up that assumption is what I'm asking for.
Yeah, I agree. And I've gotten several requests too for updates with regard to our own recreation facilities, including the skate park and the gym and aquatic center, of course. People are anxious to be able to get into those facilities, and it comes back to we don't make the rules at this level, at the city level, that we have to operate within the framework that the governor's office has essentially dictated through our county health department. So,
if I may, one final point here is that schools don't reopen in phase 2 low risk. We need to be in the phase 2 higher risk. And again, a word about data regarding that. I mean, I would like to know the age breakdown of COVID positive people who have tested positive. What is the age breakdowns? From the contact tracing, right? If I've got a 6-year-old that was the first in the household positive, is there any evidence of transmission to siblings? Is there any evidence of transmission to parents? And then again, getting a picture of spread within the community, identifying higher risk type of activities. All that information is vital for our school boards as they are looking at what class sizes, what PE looks like, what recess looks like, what the lunch hour looks like, and then when and if they do open, when to roll back, if you will. So the data need is not just for us to shape our decisions, but it's for others within the community as well.
Yeah, thank you. Thank you, Chief. Any additional questions for Chief Herbert?
Just
Mr. Oliva?
one final question, Chief. As we're talking about this data that is so important, what is keeping us, or what would you be able to point to identify that is preventing us from having that data, or what can we do better? What should we be doing in order to get that? Or does that go back to whether or not the county or the state will hire the tracers in order for us to get it?
So my best educated guess on this, okay, is that we need more contact tracers. We need more people taking a closer look at data. We need people examining existing medical records, death records even, going through those and extracting the data that we need, right? I mean, I would love to know in Imperial County of the people that test positive, which ones end up in the hospital? Is it a strong prevalence of diabetes as a pre-existing condition? Is it a strong prevalence of asthma? How does that break across age groups? And then the fatalities as well. Again, it gives us a better picture, allows us to focus on populations, specifically.
well, I mean, to follow that up, we've been asking for that kind of information with regard to our prison population, with the immigration, naturalization, and other detention facilities that are here, as well as our skilled nursing facilities. Because how are those congregate populations impacting our numbers? And if so, we'd have a very different response. I mean, we're not going to make decisions about opening our parks if we had the data to tell us that there's a fair proportion of the positive results coming from populations that aren't going to be at our parks to begin with. So, I mean, this is like the linchpin in us making any of these decisions on a going forward basis. So, I guess to go back to Mr. Oliva's question, how do we make that happen?
So again, the contact tracing and the aggregating the data does fall on county public health to do so. You know, I would encourage all of you to use your connections to assist in getting the resources needed at that level.
Okay.
Thank you. Mr. Garcia?
Thank you very much for all of your work. I mean, it's definitely been a trying couple of weeks with all of the numbers coming out and trying to digest all the data, trying to figure out the best way to proceed forward. I know that we've had a lot of discussions about it, and we're going to continue to do so to try to get a hold of this for the residents. And I appreciate all of the updates that we get. We're getting them almost on a daily basis in the morning, and to see what the state of the situation is in the city and the county. And just thank you for the information. I think that's the only way we're going to be able to really form a plan to move forward, is by making sure that we get all of the information digested and be able to be as transparent with the residents as possible so they know what we're dealing with. Thank you.
Thank you. Well said, Mr. Garcia. Mr. Jackson, any questions or comments?
Yeah, just one question, Chief, and I know you touched on it a little bit earlier regarding the governor's number of 23% and our actual number of a 7-day moving average of being just a little over 14% currently. A potential closure or rollback based on a number that would be incorrect. Is there any effort from the county EOC team to try to clarify that number, or is that number just the way it's going to be, or what can you tell us about the numbers? Because I think when you're talking about driving policy based on data, you want to make sure the data is correct. And if the data is not correct, is there an opportunity to correct that, or are we just kind of stuck with that number at this point?
Well, thank you for the question. I'm hopeful that there's the ability to correct that number. And I do have to say that my numbers are based on numbers that I'm taking from a website as well. So, and having seen that 23%, again, a week and a half to 2 weeks prior to these dates listed there, that's based on my best information. I believe that, I don't remember who, but someone, one of the county board of supervisors did make the assertion that, you know, the 23% was not actually the current data. So, yeah, I mean, hopefully that is the more accurate updated data is being shared with the governor.
Maybe they got that confused with our unemployment rate, because at one time it was right there at 23%. But I think what's really important is that Sacramento they never like us to label Sacramento. So that the legislature and Governor Newsom's office understands, again, what the true situation is.
Thank you, Chief.
Thank you.
Chief Johnson?
Good afternoon, Honorable Mayor, council members, members of the public. So I'm going to start, I think, first, before I get into some of the things from the PD's perspective, to maybe drive a couple points home. And I know we talked about this in closed session, but first and foremost, I think we need to, as a community, as elected officials, and particularly me as the chief of police, and I don't believe this has been rescinded. It's from the U.S. Attorney General, dated April 27, 2020, and it specifically talks about balancing public safety and the preservation of civil rights. So when we talk about closing things and doing things, First Amendment, the U.S. Attorney is looking very closely at all states and all local jurisdictions and how we are not trampling on the civil rights of our public. And so those mass gatherings at homes, we get into an area of Fourth Amendment of the Constitution of the United States. So we need to be very clear that the police department will not be going into homes and telling people that you're over the capacity in your own home of people that are there. We will just bring lawsuits to this city. The second point I want to make is really about one of education, right? So since March 3rd, I have not seen my 90-year-old mother with the exception of 2 times. And why did I do that? Because I know my mother is a vulnerable population at being 90 years old, and I do not want to, because of my profession and my exposure to the public, potentially want to give her COVID-19. My entire family, we have been doing this, making a very conscious decision. And I share that to really emphasize the point that I believe this council and this city, through all of our departments, especially through the fire department and the police department, we have been very aggressive in our education of our community. And I think that's important for us to understand on what it is and how we go about doing the business of the city. So I would implore you to not close our parks until the evidence and the data suggests that people are being exposed to COVID-19 at our parks. Do we have times where people may not have a mask on or over socially gathering because they're an immediate family? Yes. But there has been nothing to suggest that the residents of this great city have been going out there deliberately, with some very rare exceptions, not being responsible in ensuring the safety in the public are the people in the park. And so for 4 months, I think by closing the parks, if you choose to do that, is going to bring a lot more anxiety to our community. So I would ask you to look at that very closely. So our last meeting was about 30 days ago, I believe, right? And so let's see through the evidence of at least the reporting that I have today on how responsive or how responsible our community has been. So in the last 30 days, 0 price gouging complaints. We had 1 complaint in the last 30 days of a non-essential business being open. That case was unfounded. Social distancing, we had 7 cases, and yes, all 7 of them were found to be where there was a proximity issue or social distancing wasn't being complied, and 7 warnings were given to those individuals. And then there was actually 1 individual of a business where the actual business was given a written citation warning to put them on notice. If we come back to your business, you will in fact be cited. And there was 9 cases, I'm sorry, so let me back up, I misspoke. There was 9 cases of not wearing a face masking, and that's where the business was actually given a citation because one of the employees was not wearing a mask. And there was other instances where actual people didn't have a mask, and we carry a lot of extra masks, and we provide that to the public. So again, and then the last category is the mass gatherings, right, of the 100 or more. We've had 0 complaints in the last 30 days about mass gatherings. As it relates to the domestic violence, if you recall, it was about late April where we saw a spike in cases of domestic violence. We don't know for sure, but we attributed it to people being home and isolated and not being able to move about. I'm happy to report that we actually, from looking at this from last year to this year, we're actually down about 7%, but that's only 2 cases. So through, I think, some of the things that we've put out on social media, the information and working with our partners at social services at the county and trying to drive a message about resources and things that people can do as it relates to domestic violence maybe has had an impact. And then lastly, our child abuse cases, we did have one reporting, but that was from a case that was actually 3 years ago. So do we still have concerns about children not being around what we would quote unquote call mandatory reporters? Obviously, that answer is still yes, because we are not seeing the types of reporting that we normally would. So that's the end of my report.
Thank you.
I would open it for any
Thank you,
questions.
Chief. Chief, last Saturday I did a Facebook Live interview with a local reporter, and he was reading out loud comments that were being made as people heard me speak, and a lot of people were talking about enforcement of the face mask requirement, right? And that the city needed to be more aggressive in terms of not just warning people, but actually finding people. The point was that, once it hits people in the wallet, then they'll react to that and they'll actually abide by the guidelines. But my point is that things are never as simple as they appear to be. That there's appeal processes, there's having to go before a judge. So can you remind us and in the audience what it would take to find someone? I think we can find up to $1,000. What that takes and what that means, and also the practicality of our officers enforcing that rule.
So there's a couple things, right? And I always want to go back to the education piece, and you've heard me before use several examples, right? Our banking institutions, right, where we were having problems, and we essentially went to the bank management of 2 of our banking institutions and told the branch manager, if we get another complaint or if we observe another violation, we will in fact be coming back and issuing you a citation, right, as the branch manager. And I think if you drive down Main Street, you can see that there has been considerable effort by those institutions really to do the right thing for their customers. So I always want to go back to that. Point number 2 is I have to give my officers discretion, right? In all the things that we're seeing what's going on right now across the country, right? It comes down to spirit of the law versus letter of the law. And we may walk across somebody and find out that the mask fell off and somebody saw him and then called, and we come up to that person. There's always those circumstances and those facts that we have to take into consideration. I'm not suggesting that I do not want to cite people. I've made it very clear to the officers, if somebody is going to be indignant and say, I'm not going to wear a mask, right, they should probably get a citation, right? And we will do that. But in the vast majority of the cases, we have been seeing voluntary compliance, and there may have been one instance where somebody may have forgotten their mask or for some other circumstance, right? And the interaction between the police officer and the citizen was of a positive nature, and there was an appreciation and an understanding of the importance of compliance. And if they feel that that was being done just by the interaction and the discussion, I think we did our job, right? And so those that they will get a written citation. Obviously, we will not take them to jail in that case that you're talking about. That case will be presented to the district attorney's office. But as we know, because of a lot of things going on right now, just when and do we actually perceive or know when that case would potentially go to court, right, is an unknown.
And my understanding, Chief, is as far as the provision, the guideline for face masking is particularly when you're outdoors. So you could walk in our park as long as you keep distance without a face mask. Is that still correct?
That is correct.
You can walk even outside on our city sidewalks as long as you're by yourself.
That's correct.
You're not required to wear a face mask unless you get in proximity to other people.
Exactly. And I think that's some of the education piece, right? We see people driving in their cars with their face mask, If they're by themselves, there's really no need, right? I was actually reading a medical report over the weekend that says wearing a mask for an extended period of time is actually not good for you, right? It depletes your oxygen level, according to the report I was reading. But you're absolutely right, is that a lot of this is the education piece. If you're out jogging by yourself, there is no reason to wear a face covering. Should you have a face covering with you, so when you stop and slow down and start to walk and maybe go into an area where there's going to be other people, then certainly you need to have your mask available or your face covering.
Thank you, Chief.
Mr. Mayor, if I may, the citations that you're talking about, Chief, can you tell me what
Say that again?
the citations that you have been referring to that may or may not be issued based on discretion? What comes with the citation? Is it just kind of putting you on notice? Is there a fine?
No. So we've only issued written warnings. So essentially what happens is so if you were in violation and the officer felt through his discretion in that contact that a written warning was the appropriate disposition, they would cite you with a written warning letting you know. So what that does is it puts it into our database. So if another officer comes across 2 days later and you're in violation and you play dumb, for lack of a better term, like, oh, I didn't know. Well, that's funny. We just cited you yesterday. So that should prompt the officer to say, is it now to the level where, yes, I need to write a citation where you may be fined?
Okay, I appreciate that.
Kind of like a written warning on if you're pulled over for a traffic violation, right? The officers oftentimes will write a written warning. Mm-hmm. It's the same thing, same principle.
Oh, I
it's
see.
in the system to show that we warned you for, running a red light or whatever the violation would be.
Right.
So we could check the database and say, no, you've already been warned for this. So sorry, we're going to issue you a citation this time.
And I would like to say, Mr. Mayor, just to be clear, because I'm not a physician, I'm not in the medical field, but as you mentioned, that wearing masks over a long period of time, that it's the report that you read, that you referenced, that it could deplete your oxygen levels. And I have seen videos and I've heard the opposite, that, by wearing one of those sensors that measures the amount of oxygen levels in your body, wearing different masks have shown from the videos that I've seen and that it has not changed. And so I want to throw that out there just to say that, as you said that may be true. What I saw also may be true. And I just don't want to make sure that the conversation wasn't just definitive on one side or the other. But there are two modes of thought on that. And until I know for a fact, right, what is factual and what isn't, I just want to make sure that both thoughts are out there.
I'll give you my personal example, and this is not. The answer was given to me by a doctor, so it's a reliable source. It's just me that this across the board. I don't know, but we've heard before that one of the classic symptoms of COVID is when you lose your sense of smell and taste. Right? And I've woken up several times. Not that I lost my sense of taste, but I get a real funny taste in my mouth when I eat something. Right? Something is off in terms of my taste buds. So I mentioned that to a doctor, and he said that may be a result of the face mask that I use, because they have certain chemicals, right? Like this one has certain chemicals. This is an N95 mask. And so by breathing all that in all the time for an extended period of time, it affects my taste buds. Right? And so when I eat, I get a little funny taste in my food sometimes. But it's not COVID. If you lose your sense of smell, that may be a strong sign that it's COVID related. But this is it's more testimonial than medically driven.
So, Chief, real quick, and this gets back to, and I really tend to agree with you with regard to the closing of our city parks, and the folks that I really think about are young children or families with young children, especially in apartments that have no other space to go out and play. And it would just be, I think, really difficult to have those kids in, 24/7, stay at home with no place to be out and run around and exercise. So have you been contacted? Has the department been contacted and asked to respond to gatherings of folks in our public parks?
Yes, we have.
And then what's been the outcome and how frequently and how do we, if we're going to stay open, we're going to have to be able to say we're going to stay open, but we also recognize we're going to do X, Y, and Z to ensure it doesn't become an issue.
So, and again, my recollection is I know we had one or two at Buckland Park, right? I know the outcome, at least one of them was an actual warning to some folks. But I also believe there was one where it was kind of a family walking together. And again, they're all living in the same household. They're in close proximity. Would it make sense and be better advice for them to wear a mask to make everybody around them comfortable? Absolutely, right? But the fact that they were all living in the same household really suggests that the mask is not going to do any good for any of the immediate family, right? And I think we did maybe respond to one other one where some kids were playing basketball or soccer. I don't remember specifically. That was several months ago, but I can tell you in the last 30 days, I don't believe we responded to any calls in a park.
Very good. Thank
I think
you.
most of them were business related.
Okay.
Can I follow up on that question?
Of course.
Well, I recognize the fact that if you're living in the same household, the argument being that it doesn't make sense for everyone to have to wear a mask. But when I hear that, for example, me wearing the mask is partly for me, but is also for you.
No,
right?
it's for the other people.
Right, it's for the other people. So could it make sense to say that a family that still is living under the same roof should be wearing a mask, not so much because they're protecting each other from each other, but because they're protecting themselves from the other people that are also at the park? Because granted that in a few minutes that they're walking together and they're physically 6-10 feet apart from someone, at some point that will not be true as they're walking the track around, because there will be other people walking the track. So at some point they will come in close proximity to others, and the likelihood that they are telling their children or their spouse or whatever, really quickly, put on your mask because somebody's coming and you can take it off afterward. I feel that is not happening. And is it then possible that in that moment there's a breach in public safety protocol?
Absolutely, right? I mean, I think this really, why I started my comments in talking about the education and what we can all do, right? If I go to the park at 5 a.m. to walk or jog, I'm probably going to be by myself or maybe 2 or 3 other joggers, right? We just know that. If I go at 7, 8, 9 in the morning, we know more people are prone to walk in the park on a Saturday and at those times. And everybody should be understanding, yes, the example you just cited is a very likelihood that it could happen, and we should all be wearing our face coverings. No disagreement with that. I think it goes to the time and place and the understanding of, hopefully we've done a great job of educating our residents on what are the proper protocols that we know that we need to take when we're out in public to the best of our ability, right? Because none of this is 100%, that we're protecting each other. And that's why I like to tell that story about my mom. I know 100% I can't protect her by going to visit her. That's why I've only seen her twice in 4 months and didn't get closer than 10 feet from her, because as best I could, we were all wearing masks. And because I didn't want to take an opportunity to potentially give her COVID-19, even though because I may have not known I had it at that time, to protect her. And if every resident would do the same thing with their immediate family and have the same respect to know when they go out into the public that you have a duty and a responsibility to protect your fellow resident and citizen or member of this community, I think we'd be a lot better off.
Thank you, Chief. Any other questions, Mr. Garcia?
Yes, thank you very much for all the hard work, Chief. I know it's been a trying time lately, especially with Officer Cornell. And it's just, I want to thank everybody in the ECPD that's working diligently. And I know we're we're definitely going to have an uptick in calls with the 4th of July weekend coming up, and hopefully our residents will act responsibly and try to adhere to these rules so we can get these numbers under control.
Thank you.
Thank you.
Thank you, Mr. Garcia. Mr. Jackson, any questions or comments? Mr. Chief Johnson?
No comments. Thank you.
Thank you, Chief.
Thank you.
Dr. Edward,
I
fresh from the Senate committee meeting.
Great job on the Senate hearing. After we finish this, could we get an update from Chief Herbert on Nyland? And did EC Fire, we responded, no, we're okay. We'll finish up COVID and then Nyland. Thank you.
Would you like me to share with the committee members what we said, or you've already?
Please.
It's a 5-minute testimony if you'd like to. I just wanted the public and the community here to know that we were representing you for your approval on a Senate Select Committee on California-Mexico Cooperation. The special committee is on pandemic response on the COVID-19. And here's my testimony. I'll share it with you. Good morning, committee members. Thanks for your taking the time to listen to our inputs and for all you do to assist Imperial County to fight back against coronavirus pandemic. Your help and support is requested, needed, and appreciated. I'm especially thankful to Senator Wesso, who has been a strong supporter of El Centro Regional Medical Center throughout his career. I told him that I'm the CEO of ECRMC and that the UC Health System has been managing the hospital since 2016. And in essence, we're all state assets. On 18th February, ECRMC stood its Operations Command Center and put the team on high alert. I think I'm glad that I've had the military training that I've had to prepare me for what I was about to see. On or about 8 March, I announced to the residents of Imperial Valley the arrival of our first COVID-19 case. The family members had traveled to see their kids in Mexico and Florida, and they were returning through Atlanta, Georgia. One family member had passed away since. This is one of those many stories that have become the new normal since that day for all of us. The impact of COVID to those who have lost their family members is devastating and no doubt has changed their lives forever. We have seen a nonstop increase in cases at ECRMC since that day, including an increase in the number of cases coming from Mexico. Across the border from El Centro, well over 275,000 U.S. citizens who live in Mexicali include 30,000 retired U.S. military veterans like myself and thousands of green card holders, but also reminded them that 60 of my own staff members of 1,100 live in Mexicali, and they are essential employees for us so that we can fight the good fight. Many of those folks travel to El Centro and our hospital and seek care. ECRMC does not ask patients about their national origin, their ethnicity, or sex, or even health insurance coverage, and so we render care to many. Beside the 500 patients plus patients that have been transferred, we have seen well over 2,000 patients since that day. Daily, we see 100 to 125 or more patients that have come through our emergency room department. On one day in May, we saw 65 plus COVID patients that were in the hospital out of the total of 110 patients. That's 60%. Initially, we transferred 2 to 3 patients each day for care we could not provide, but now we're transferring 5 to 10 patients a day due to the excessive COVID care needed that we cannot keep adding to our limited capacity facility, which is constrained by size and staffing. We have seen an increase in the number of cases as well from our own community members who travel to Yuma, Arizona, as well as other locations, and then because these are open areas. These members return back to Imperial Valley and come to the hospital with COVID symptoms. ECRMC have lost $2 million in the first month dealing with COVID in February, and have lost $4 million each month since then. The Federal CARES Act funds are drying up fast. Additionally, a hospital like ours will be receiving additional remdesivir allocations. Under the agreement, ECRMC has been using the drug and with great encouraging results, but will now have to pay the wholesale acquisition price for the drug, which is close to $3,200 per treatment course, which AmerisourceBergen is willing to provide. The problem is that will add another $500,000 in expenses to our bottom line that we do not have today, and we will need help covering all these costs. We have received plenty of help from the state of California. We've had 2 disaster medical assistant team mobilize and help us with staffing. We also had the California Department of Public Health mobilize at least 8 young, newly minted RNs to help us. We've had the Air Force Reserve send us a team of clinical therapists and doctors. We have learned that they will stay until the 15th of July, and I cannot thank the Air National Guard medical team for the extension. We can't thank enough the emergency medical response team headed by Dr. Dave Duncan for all the help he has provided to us, as well as OES and our own county heroes of EMS team. We have arranged for full air, ground, and emergency requests to offload patients into other facilities in other counties when we needed it the most. If he had not done so, we would have been overwhelmed, but we are not currently overwhelmed. We also have shared our needs with many high-ranking state officials, including recent visit by Dr. Sonia Angel, the state public health officer and the director of the California Department of Public Health. We informed her that the design and the delivery of the alternate care site in Imperial County was lacking the right support to fight COVID. We need the 80 beds to be used for high level of care so we can decant our ICUs. For that reason, we continue to ask for support so we can stay and stop relying on transferring of patients outside of the valley. As hospitals in San Diego County and across Southern California begin to fill up with COVID patients, our patients stay with us in the ED waiting for transfers in upwards of 3 days. It is not clinically acceptable. We receive many reasons for the delays, but most do not make sense, such as asking for the patient's insurance status. We asked the California Hospital Association for help, and they have been supportive, but we continue to rely on transferring patients to UCSD. Our first ask from the state of California was to continue to understand this is not easy to have all the resources needed to make critical care and ICU care readily available. It is expensive and provided through companies that are charging large amounts of money to share the assets with us. The critical care needs include intensivists and other resources. As I've defined it to Senator Wesso and the team listening from the Senate, we need 4 intensivist physicians, 28 RN nurses, 14 respiratory therapists, and 20 complex vents to expand our capability, and I will address that soon. We have relied on support from UCSD for our intensivists and have advanced the delivery model in our ICU because of that partnership. We continue to get support we need, but UCSD too may see a surge that will task them, and hence our need to ask for this kind of manpower support from the state. With close to 30% unemployment rate and with 43% of our patients on Medicaid, we will continue to need help caring for our community beyond this month. We are thankful for all this help the state of California has provided us so far. However, Imperial County needs the state to help stop our reliance on a transfer system that may be non-existent in the next few months if COVID patients increase across the state. We need more state support to staffing or support us financially so we can go out and pursue the staffing ourselves. Our second ask is that we do not forget ECRMC and our reliance on disproportionate share hospital dollars, 340B program, and the state prime program, and more state funding system just to make ends meet. Please discourage any cuts in these programs for both Imperial Valley hospitals. We are passionate about this valley and the care that it needs. I thank them for their time and thank you for your support of Imperial County, and I open it up for questions. This concluded my comment, but I wanted them to understand there is a difference between what we can do, what we're able to do, and whether or not the state is going to continue to support us. We need their support to get this staff. This is not about a facility or a system or whether I have a bed or 2 beds. We're wasting a lot of time with this discussion. We need real state of California support to the financials that are required to actually pay for the care that we can provide here. We're a great hospital. We're a great healthcare system here, and we can do all these cases down here.
I will say I had the opportunity to watch almost all of the Senate hearing, and as soon as Dr. Edward concluded his remarks, Senator Wesso thanked you for being so specific with regard to your ask, and I think that that's something that we need to continue to follow up on. We need to be specific in our ask and make sure that what is coming back to us is what we can actually use.
Just to let you know about the follow-up, we're actually drafting a letter right now. I've asked the head of the Government Affairs Office at the University of California to draft a very specific letter to Senator Wesso and to Congressman Vargas and everybody. That letter will probably be signed today, if not tomorrow, and it will be on its way to the Senate as well as the Capitol Hill for the congressional support that we need.
Thank you, Dr. Rivers. Thank you for amazing work like you always do. And any
Yes, sir. I just want to update
Yeah,
for the community. We actually thank you. The heavens are open. Our numbers are down to 45, which is COVID positive patients. That is actually a reduction in numbers. I know it doesn't seem so, but we're happy about the 45 today. Our hospital inpatient census is sitting at 81. We do have bed capacity. Our ICU beds are at 11. And we are going to have an expansion strategy. So let me share with you what that is. We're going up in the total number of beds, as I shared with Dr. Dave Duncan from the state. We're going up to 16 beds today. That's an additional 4 beds, and then another 4 beds to 20 beds by July 6th. And then by the expectation that July 4th, people are not going to listen to us asking them to mask and social distancing. They're still going to have their parties. We're actually going to increase the beds on July 13th to 26 beds ICU capacity. Our actual med-surg beds, thanks to the hard work of the staff, is going to go up from 74 to 96 and now 117 beds by July 13th. And we have actually already contracted through our vehicle that we've been using for quite some time to bring in the right staffing mix to include everything that we need. We did ask this morning that the state provide us with 20 additional vents to the existing vents. We do have vents, but we want the complex vents so that we can actually be able to care for people that are very obese and are diabetic or whatever. The comorbidity and or the complexity of these cases requires what we call the complex vents. And that's why our respiratory therapists are always asking us, do we have the complexity of these vents? Can we get more? And I asked for 20 this morning.
Perfect. Thank you, Dr. Edwards.
Yes,
Any additional data that you want to provide to us right now?
No, sir, that's all what I
let
have.
me bring it back to council, see if there's any questions. Mr. Oliva?
I just wanted to first ask if Mr. Garcia wanted to share a tour we had, if you wanted to mention that, or may I?
You can, go ahead.
Okay, I just wanted to mention to the public and to share also that Councilmember Garcia and I toured the hospital this Saturday. It was a pleasure, and thank you for allowing us to do that.
Yes, sir.
We did want to be able to see it for ourselves, firsthand experience to see what was going on. And I mentioned to you that day, and I will mention it again now, and that is that with a lot of commentary that we have seen in social media as well as in national news media outlets, I was expecting to see kind of a war zone type hospital, right? And
Right.
I said it jokingly, but with a little sprinkle of truth in that I expected to see beds in the middle of hallways, right? I was expecting to see staff running across, just in high anxiety situations and whatnot. And so what I did see, I didn't see any of that, by the way. But what I did see was, some seriousness, some calmness in your staff. The ones that we saw in the break room seemed to be in very high spirits, right? They very much were enjoying their break, by the way.
Right.
I did notice that. But the patients, and I will make sure to see if Councilman Garcia can agree with this, and that is that I still see the images of the patients in my mind. The ones that are in ICU looked like what could have been my uncles, my aunts, my grandparents. One thing that stood out to me was that many of them are older residents, and they looked very frail, very weak. It's a sad sight to see, and I recognize that your staff sees that every day, and that I would only imagine have somewhat normalized it in some way. It definitely is not normal for me to see that. So it stood out and it left a very lasting impression. There was one gentleman that I believe Councilman Garcia and I also noticed was very young. He looked about our age, and he looked knocked out, right? From my recollection, he was somebody that had just gotten into the ER and was presumptively COVID related. And when we looked at each other and said that could easily be us, because it's not age specific, right? And that depending on your own personal pre-existing medical condition, that could easily be us.
And Councilman Oliva, if I may get the community's attention, a lot of the young folks believe they're immune to COVID-19, and that's flawed. We've seen as young as 28 years old. We've seen mothers who are pregnant that have come to us that are COVID positive, that are fairly young. We've seen people in their early 30s, their late 30s. The problem with the counties that open up the bars, I don't know which counties those were, but there was crowds in the bars, and people let their guards down. I discourage anybody to let their guards down. I know I keep saying, learn to live with the mask. You got to learn to live with the mask for quite some time, because if you don't, we're going to see you in the ICU. We don't want that. And you now understand what we see every day. And it's tasking when you see somebody that looks like your father in front of you, and you go, oh, wow, I don't want that to happen to my family.
Right. And the last thing that I will say is I did see beds available. And when I asked you about these beds, you mentioned that the reason why they may not be in use is because the bottleneck that you're facing is the lack of staff.
Right.
Right. And that highlighted to me very well. That was something that I observed personally, and it was the lack of staff and those types of resources that is hindering you from perhaps offering the type of services that you are prepared to do. And so that is a resource that you need. The other one was that you could also use additional supporting staff to relieve your current staff and allow them to have a longer break, because they are working far beyond what they would have expected to be working. And so for the reasons of the capacity, the infrastructure, I know that you have at your hospital is being hindered due to lack of staff, and your current staff is being overworked. And so that was prevalent to me, and I will stop there and ask Councilman Garcia if he has anything he'd like to add to that.
Garcia?
First of all, I'd just like to thank you very much for the opportunity to actually see what's going on in the hospital and to tour it. We did have to take extra precautions because it's a contaminated area where we did end up touring. I personally am never going to forget the patients that I saw in the ICU. They all looked very similar in terms of how this disease had an impact on their bodies. And it was, like I said, something I will not forget. It's something I would not wish on anybody. And it's a wonderful reminder to remember to wear a mask, social distance, and of course, this disease does not have any impact based on age. I mean, it does have an impact based off how tough it could be on people, but it affects everybody.
Right.
And that was very, very sobering when I saw that person who was very young. He looked fit, and he looked like he got hit with a sledgehammer. He was not doing well. I hope he has a speedy recovery, but I'd like to definitely thank the staff at ESCRMC. They were working very diligently, using all of the equipment that they have recently received. I did notice that there was plenty of equipment, that the issue was that there is a lack of staffing. We toured the tents, and they were empty. We did not see the influx of people that had been reported in the national news. It did not fit the rhetoric that we'd been seeing. However, this disease is nothing to be joked about. It is a very, very serious disease that has a horrific impact on certain people. And we are seeing the uptick in numbers in young people because other places opened up too early. We have a lot of cases in Arizona. I believe the statistics said that almost half of them were people between 20 and 40 now, and that they're having some serious issues because all of the social gathering areas opened up, and that's why they've taken such drastic measures to lock down again. But I have faith that the hospital is going to continue doing a good job in treating these patients, and hopefully we can practice responsible social distancing, especially with the weekend coming up, the holiday weekend, so we do not have anybody going in there. And a mask, while it may not necessarily protect you, it will protect others if you're asymptomatic or if you barely have a mild symptoms. And trust me, you do not want to be in a position where grandma gets sick because you didn't wear one. You don't want to be in a position where your parents get sick. You don't want to be in a position where your children get sick because you don't adhere to these principles. And I noticed that the staff, every time I saw them move from room to room, they were using hand sanitizer, they were wearing their proper PPE equipment, and they were being very diligent in order to keep this in the certain areas where the people were being most affected. Because the hospital does have different sections for people that are COVID. It has when people come in that are presumptive. It has other places where they're in the ICU and they're receiving some very serious treatment. And those are the ones that definitely it was an experience to see them, and it definitely is something that I wanted to get out to the public to let them know what is actually going on, because that's a level of exposure that we don't want people to have. And that's definitely an illness that we do not want to be proliferating in our community, whether it be our city, whether it be our county, whether it be our state. And that's something we don't want to see keep spreading. So it was something that I wanted to see, and thank you so much for being so gracious as to provide us that opportunity so we can take this as serious as it needs to be taken.
Thank you, sir. And I want to, on behalf of the staff, I want to thank the mayor and the council members for their positive encouragement, support, and always remembering us. I really appreciate it.
Thank you. Thank you, Mr. Garcia. Well said. Ms. Walker, any questions?
Just one real quick thing. As we're starting to see the uptick throughout California, there's been a greater emphasis on ECRMC and pioneers transferring so many people out. I think it was mentioned today during Senator Hueso's hearing that upwards of 500 people have been transferred out, right?
Right.
And now, because we're seeing the uptick and the bed availability being impacted in other parts of the state, we're starting to get more of a pushback in being able to transfer patients out of here.
Right.
Do you see that as becoming a problem within the next couple of weeks? Or
In the next 2 weeks, we should understand whether or not we're going to see a downward trend towards August and September. But in September, I probably would like us to be ready and prepared for another upward trends. That's the normal start of a flu season. Into October, we're going to see an increase into November and December. And now the projections are taking us all the way to February of 21. So that's why I believe we need to start to live with the fact that we need to be able to make care here instead of reliance on transfer, because the one thing, though, that's noted in the state of California that's least talked about, but it's worth conversation, is that Northern California is not hit as hard. One of the things that I'm actually proposing to the Office of the President of the University of California is to actually think about deploying Title 32 and the Air National Guard to be able to move patients using planes that we know are in existence in California that can go further with higher levels of oxygen. And the reason for that is just in anticipations that if all of Southern California is going to be impacted, we need to rely on our own state and look at the northern portion and see what we can do up in the north. I think they should start to have plans for that. That's why we have people we call in the military medical planners to plan for incidences like this. We haven't asked them to actually help us get engaged, but I've been trained in that business, so I'm asking the state to please request a review on both Title 10 and Title 32 to be able to execute a strategy and or fund us here for a what we call an EMEDS plus 50 basically increasing our capability in upwards of 50 beds so that we can take care of this business down here, whichever way the state wants to go. There are solutions. The state and the feds need to work together to make it both happen. I was told at the state level that the feds rejected that offer, and I think if I am the governor and I'm speaking not on his behalf, but I'm speaking to him, he needs to push the feds and use every asset available in our inventory to care for us down here in Imperial County.
The last comment I want to make, and I think that we touched on this earlier, is that every day we hear something new or something different. And I think it was this morning I read that the reason the United States has been so impacted worldwide, and I mean in comparison to other countries worldwide, is because the virus is actually mutating. I think that's the word. And whatever is going around in the United States is actually much more contagious, is a more contagious version. And so we have to be doubly vigilant.
Right, and I'm sure you've heard about the St. Louis encephalitis. It's already here. The county public health, I think, has pushed out some information on it. So make sure that you spray the children before you go out and play outside. There's many things that will be affecting us, and mutation, I'm not surprised at all. Viruses love to mutate. Yeah. They love to surprise you. The next COVID, which we don't know what that's going to look like, might be soon, and we don't know.
Yeah. Thank you, Dr. Edwards. Mr. Jackson, any questions from Dr. Edward?
No questions, just a quick comment. Thank you, Dr. Edwards, for your leadership at our hospital, and thank you for continuing to provide excellent health care to our residents. And I know you and your staff at El Centro Regional are working tremendously long hours in providing that care. So thank you very much, and please pass on our support to our hospital staff.
Thank you, sir.
Thank you, Dr. Edward. Before we transition into the Spanish reports, Chief, Councilmember Walker asked about the status on Calipatria.
Island.
As they're setting that up, Mayor, I just wanted to remind you, I do have a commentary I'd like to make. If you could tell me when the appropriate time would be.
Okay, maybe after the Chief.
Thank you. Okay, so really quickly, so Saturday evening, right, there's a fire in Island. Was Saturday or Sunday? Saturday, right? Thank you. Losing track of days here. So we did respond at the request of Imperial County to assist. Engine company and Battalion Chief responded, speaking with Battalion Chief Joe Bernal about the conditions. He said that it was a very wind-driven event. The winds were much stronger there than they were here in El Centro. So it just really spread the fire in very rapid fashion, starting in a field, going to palm trees, and everything downwind started sparking palm trees, and those quickly spread the structure. So it was a rapidly moving fire. There was approximately 40 homes destroyed, if not a little bit more, and about 45 to 50 families displaced. The shelter was set up in Calipatria, and the Red Cross was called out to assist them. The county also utilized resources from out of the county as well to contain the fire. And I believe they got it initially under control. Some of those resources released about 12 hours after the fire started.
I'm going to ask our city manager. I know that there have been several community organizations that have been looking for donations, and it seems just a tiny bit fragmented, but could you maybe push something out on our own to us and let us know maybe how we could best help those families? Thank you, Chief.
Thank you, Chief. Mr. Oliva?
Oh, yes. Thank you, Mr. Mayor. And so I have been listening, and we've been inundated with information regarding our community and the restrictions that the governor is suggesting, as well as the County Board of Supervisors being asked to take certain actions. And one of the things that is has stood out to me is that there are plenty of people in our community that kind of point towards something and say that's the problem. And without the tracing, the contact tracing data, we really don't know. We really can't say that it's one thing over another. And that's something that I believe is true after speaking with staff. And so until we get there, We can't say 100% that it's either gatherings or businesses or whatnot, but between today and the time that we get that data, many days will be between now and then, and I fear that in those days, we will have many more people impacted by the virus, and we may tragically lose more people in the process. And so, as I look at what we can do, what is within our authority, and what is not within our authority, I feel that I find myself frustrated in not wanting to wait until the county says something that's a little bit more firm and stricter. I really don't want the governor to come in and make a declaration as to what we should or should not be doing. And I just wanted to let you all know, as my colleagues, that I personally do not feel that it is our businesses that are creating the space that is causing such a high rate of contraction of this virus. That because for the most part, we have not transitioned to such an extreme sense of our businesses. We just recently allowed for walking into businesses, but our rates of contraction have always been relatively high. So I want to say that I can't, in my mind, keep in mind that this is not data driven, but this is just observations and seeing how other communities are also being impacted and whatnot. We have regulated businesses throughout this entire process pretty significantly, and our rates of contractions remain high. The one thing that I think that has not been regulated is people's social behavior. That is something that we have just kind of said, we will leave it up to you to decide, use common sense. And quite honestly, at this point, I think there are plenty of people in our community that feel that the same way that we are restricting and adding prohibitions and whatnot on businesses with actual consequences, that we need to have that level as well on an individual standpoint within our communities. And so this whole monologue is really just to ask, to let the people know that I would like to ask the mayor and the council to consider measures by which we are actually implementing fines for people who are not wearing their masks correctly when they're supposed to, because there is a guideline that says when you're supposed to, when you're not supposed to, as well as imposing fines for people who knowingly know that they are positive and are still out and about creating non-essential travel, leaving their home. Because quite honestly, we heard a story from someone that...
Stories on Saturday.
Two stories. As far as people who knew that they were positive, going to the post office, going, to visit some businesses in the valley, and it made me scared in the sense that, like, how do I not know that if I'm going to Vaughn's to get milk, that someone in there knowingly knows that they're positive and they're out there because they want Starbucks, because they want something like that. And it's a dangerous thought, but I know that there are no consequences currently for that other than just, we hope that you're not doing it. And so I really would like us, if you will indulge me, to put something on the agenda in our next meeting. And that way it will allow for the community to let us know if they're in agree, if they would like us to really consider it. But putting that mechanism, and the reason why I'm going to this point is because I remember early on and throughout this entire pandemic where we strongly encouraged folks to wear masks, and it was a hit or miss. But the one thing I think the county did right was early on, they required it and they attached a $1,000 fine if you didn't. Now, I don't know exactly how many people got that fine, but I will say that I noticed right away people wearing their masks because of the threat of potentially getting a $1,000 fine. And it really wasn't so much the collection of it and whatnot, but that just woke them up and they knew that there would be consequences if they didn't, as opposed to just saying, do it because we told you to, right? And so what we're trying to do here is really determine or to show the people what is correct behavior and what isn't. And by doing strongly encourage, you kind of pretty much allow everyone to determine that for themselves. But here we are, under the microscope of the state and the country. And I really believe that our constituents are saying, we need you to take a firm stand because things are bad. And I will admit that I have two very close friends of mine who lost their mother in the last couple of weeks to this. And so it's out of respect for them, out of respect for anybody who's facing a current tragedy within one of their parents to say, I just wish other people took it as seriously as we are taking it. It's for the people who maybe 80% of our constituency is adhering to the rules, but is starting to have resentment over the other 20 that are not. And so if we need to have firmer standards, I say let's consider it, because if you are doing your part and you're adhering to it, it shouldn't matter to you whether there's a fine attached. It will not affect you. You're not going to be bothered. It will bother you if you are actively refusing to adhere to the policies and you refuse to do them just because of your own benefit without taking into consideration the public health of the rest. And so that, as well as the last thing I will ask, and I appreciate the indulgence, is to explicitly state that there is currently a moratorium on evictions in the state, but I would like for us to reiterate that and make it clear for our folks, because I think that as this drags on, more and more people are going to have issues with paying their rent. And I think that it's becoming convoluted. I would hate for somebody to initiate eviction proceedings or without having the proper information. And as we all saw, the number of delinquencies on our water bill or the IID bill, you could see that in the last month, it's ticked up a lot. And I think it's because folks have run out of their stimulus check money. The unemployment insurance claims are starting to dry out because I think they were only insured until sometime in July. So as this drags out, things are going to get more serious economically for folks. And so I just would like to ask for the consideration of those things on our next agenda.
Thank you, Mr. Oliva. The only thing that I would say is that as we work on those recommendations, that we get some direct feedback and support from our chief, because I think, Chief, for me, the implications of that are really important, and the viability of some of those suggestions that Mr. Oliva is making, I think it's important. So I'm going to rely on you to be able to give us a full picture. So, Mr. Oliva, if you don't mind working with
Absolutely.
Chief Johnson and also our city manager.
Well, then, the other thing with regard to the evictions, and I don't remember who among us, this was a few meetings ago, talked about, you squeeze a balloon and it just kind of redistributes where the air goes in the balloon. What we're finding is that, so we've stayed evictions for renters, but what about the widow who is renting her home and that's her source of income to allow her to continue to be economically viable, right? And so now there's winners and losers in all of this. So if we allow renters to go without paying, that's going to cause somebody else a lot of pain. And there's a perception, I think, an erroneous perception, that if you are a landowner renting to someone else, then you've got an abundance. And so I think we have to be really careful as to who's where we're squeezing that balloon, right? And to make sure that, because we are creating through that very process winners and losers.
Thank you, Ms. Walker. So let's go ahead and move on to Spanish reports, and then we still have closed session to attend to. And I know Ms. Walker won't be able to join us because she's got a 2:00 meeting, but let's go ahead and vamos a empezar con nuestros reportes de COVID en español, y de veras aprecio a las personas que nos acompañan para también dar información a nuestra comunidad latina que no habla inglés, con los datos y actualizarlos en los esfuerzos de la ciudad del Centro y del Hospital del Centro para combatir esta pandemia que ha afectado a nuestra comunidad a niveles tan elevados. So, vamos a empezar con el hospital. Lupita, ¿vas a traducir para el doctor Edwards?
Mr. Mayor.
Yes, I'm sorry, Mr. Jackson, yes.
Yes, I'm sorry, but I'm going to have to drop off also. I have a 2 o'clock meeting I'm going into.
Thank you for joining us, Mr. Jackson.
Thank you, guys.
Buenas tardes a todos, comunidad y miembros del concilio. Señor alcalde, muchas gracias por la invitación y por permitirme el honor de hablar con mi comunidad. He escuchado muchas cosas muy importantes y muy valiosas. Yo vengo en representación del Centro Regional de aquí de nuestro condado, pero también vengo en representación de nuestra comunidad. Una de las cosas que resuena, como acaba de decir el señor Oliva, miembro del concilio, es la responsabilidad de cada miembro de nuestra comunidad. Esto no se va a detener si nosotros no tomamos la responsabilidad que se necesita para detener esta propagación. Y aquí sí, verdaderamente, hablando acerca de la enmienda de la Constitución, la muerte no tiene enmienda. Se puede proteger bajo el artículo 1, la enmienda del artículo número 2, del 4, del que usted quiera. Pero de la muerte no hay enmienda. Gracias, señor Oliva. Gracias, señor García, por ver ido y con sus propios ojos ver observado lo que realmente es lo que pasa con los pacientes de este coronavirus. Me gustaría proponer que alguien tomara el tiempo e hiciera desde el comienzo para beneficio de nuestra comunidad y todos aquellos que todavía tienen duda que esto es contagioso y puede ser altamente peligroso, que se hiciera algo que se pudiera discernar en nuestra comunidad para que nuestra gente supieran el peligro al cual exponen a toda su familia en la casa. Si yo expusiera a alguien, jamás me iba a poder perdonar el verle causado el daño a cualquiera de ustedes o a cualquier miembro de mi comunidad. Eso es ser responsable. Los problemas que se están enfrentando en el Hospital Regional del Centro, sí, en efecto, tiene que ver con el cansancio, con la falta de personal, en veces con falta de cierto equipo, pero somos seres humanos y estamos tratando de hacer lo mejor que se puede. Ahora sí, sería interesante mirar cuando se haga la próxima encuesta, porque definitivamente hemos visto una alza de pacientes en el Hospital del Centro. Entonces, si ustedes como testigos de nuestra comunidad, como miembros del concilio, como líderes, como personas en las cuales nosotros confiamos como comunidad, ustedes ya miraron con sus propios ojos lo que está viviendo esta comunidad, ¿cómo no buscarnos ayuda? A nuestra gente le digo que está cuidando, esta gente que miran aquí, que piensan ustedes que nomás están sentados, está apoyando al condado del Valle Imperial, no solamente a la ciudad del Centro, sino a toda nuestra gente. Trabajan duro, largas horas, mañana, noche, tarde, para que nosotros estemos seguros. En el Hospital del Centro hay un líder, pero ese líder responde a su mesa directiva, que gracias a Dios ha apoyado a nuestra comunidad. No importa de dónde vengan, el coronavirus no le importa si hay frontera o no hay frontera, si tiene papeles o no tiene papeles, si tiene dinero o no tiene dinero. Una cosa sí es seguro, el Hospital del Centro siempre ha sido uno de los mejores lugares en el Valle Imperial para proveer cuidado de salud. Y déjenme decirles a toda la gente que nos esté escuchando, el señor Oliva tocó un punto bien importante y yo quiero compartir un poquito con todos los que estén observando, que cuando toca en la familia de cada uno de nosotros un caso de coronavirus, nos cambia la vida. Usted tiene razón, su mente jamás será la misma, porque es impactante. Señor García, también para usted, mirar que aquella persona entró y que cuando salió sola en una carroza, no es una cosa buena. Es un dolor como si alguien metiera la mano al corazón de nosotros, lo arrancara y lo tirara. Pongan ustedes un poquito su mente de cómo se siente un equipo de 6, 7, 8 enfermeras, doctor, terapista respiratorio, haciendo respiración artificial en un cliente porque alguien más no se puso la máscara y lo contagió. Como comunidad tenemos que ser responsables para poder salir de esta. Y hoy es un día especial porque tenemos gente que le interesa nuestra comunidad. Por eso han sido elegidos a la posición donde están. Necesitamos de su colaboración, de su apoyo. Nuestra gente los necesita. Necesitamos mantenernos juntos y trabajar juntos con grandes ideas para salir adelante, porque este es algo muy peligroso. Esté joven o esté viejo, no importa, no discrimine edad, género, raza étnica, no discrimina absolutamente nada. Y sí, en efecto, como acaba de hablar la señora Cheryl Walker, está mutando este virus. Vayan ustedes a saber, ya para septiembre, octubre, noviembre, diciembre, que es el tiempo de la gripa, cómo se va a juntar gripa con este tipo de virus. ¿Qué es lo que va a pasar? Entonces tenemos que prepararnos, comunidad, tenemos que prepararnos, escuchar a esta gente que sabe más que nosotros y que verdaderamente le importa lo que está pasando con nosotros y nuestra salud. Sí tenemos problemas económicos, tenemos problemas de salud mental, tenemos problemas de vivienda, de comida, hay el problema de Nyland, de lo que acaba de pasar. Pero sí, en efecto, si toda esta comunidad, el Valle Imperial, no trabaja junto para contener esto y no hace su parte con algo tan sencillo como proteger la cara con una máscara, este problema verdaderamente nos va a causar un gran daño. Y quizás ese daño no sea tanto en otra familia, sino sea como lo fue en la mía, con un hermano de 70 años que duró entubado 2 semanas, debatiéndose entre la vida y la muerte, y que gracias a Dios, después de la 3ª semana, se levantó. Yo fui afortunada, pero en primer mano pude sentir el dolor de toda esa gente que he mirado llegar a mi hospital del centro, el lugar que tanto amo como miembro de esta comunidad. Y estoy hablando no como empleada del hospital, sino como miembro de esta comunidad, que conozco la trayectoria de la gente que nos apoya y que trabaja con nosotros. Hay que escucharlos a ustedes, hay que escuchar al líder de la organización, porque es el que sabe a las 3 de la mañana lo que está pasando, a las 12 de la noche qué está pasando. ¿Cuál hospital del norte de California no quiere aceptar a nuestros pacientes y tienen 27 horas esperando en un cuarto y tenemos más esperando afuera? Gracias, comunidad, por darme la oportunidad de hablar con ustedes. Gracias, alcalde. Gracias, gracias, gracias. Síganos apoyando. Señor García, gracias por haber visitado el centro regional. De parte de los empleados, le agradecemos tanto a usted, señor Oliva, que haya ido y haya mirado con sus propios ojos lo que verdaderamente es. Lo único que les puedo decir que posiblemente fueron en un día cuando el censo está un poquito calmado, pero en esos días cuando está feo, que están llegando 4 ambulancias a la misma vez, se pone un poco difícil. Yo pienso que las personas de esta comunidad, en un pequeño video que se distribuyera en el condado del Valle Imperial, enseñándole, mire, así llega la ambulancia con el paciente, con un paciente, luego se mete a la sala de urgencias se cambia a cuidado intensivo, mientras que le encontramos una cama para ver si le podemos salvar la vida. Y si, ya cuando sale de cuidado intensivo va a un helicóptero para llevárselo a otro lugar, sin saber si esa va a ser la última vez que usted tendrá la oportunidad de mirar a su ser querido. Porque nada, nada, nada es cierto en esta vida. Esto es una lotería. Estamos mirando que el impacto está más en qué? En las poblaciones más vulnerables, personas con diabetes, personas que nunca han ido al médico, personas que tienen problemas de la vía respiratoria, personas de la tercera edad, pero no le interesa porque si usted es un joven de 28 años con un problema de obesidad, ¿y cuánta gente no hay obesa en el Valle Imperial? Ese es un determinante de la salud con este coronavirus. Sin más ni más, por favor, comunidad, les pido por el bienestar de ustedes y de su familia y de aquellos que ustedes aman y aquellos que ustedes no aman, pónganse la máscara. No es mucho pedir para salvar la vida que tenemos enfrente. ¿Alguna pregunta?
Gracias, Lupita, por esa presentación tan impactante, tan fuerte, tan certera. Yo le voy a sugerir al doctor Edward que tome este video y lo publique como un public service announcement porque lo que mencionas es algo muy cierto, muy impactante, con mucha pasión. Y quién más que tú sabe lo que está sucediendo en el hospital y te agradezco mucho que estés con nosotros.
Gracias.
Dr.
Gracias
Edwards,
a todos.
I'd like to suggest that you take this testimony right now, today, in Lupita, and you pull the video and you use that as a PSA because it was a very, very impacting presentation that she just completed. Gracias, Lupita. ¿Tiene preguntas para
Gracias, Lupita, por todo lo que estás haciendo, para la información que le estás dando a la comunidad y también para el gran trabajo y la lucha que estás haciendo en el hospital y que sigues haciendo eso para salvar las vidas de los residentes del Valle. Gracias con todo mi corazón.
Gracias, señor
Oliva.
García.
Sí, Lupita, además quiero decirle muchas gracias por los comentarios. Se nota la pasión que tiene, el orgullo que tiene usted en trabajar con el hospital, pero también espero que la gente nota también la urgencia en su voz, el mensaje que está usted diciendo y que es muy importante. Y muchas gracias por haber dicho todo lo que has dicho.
Gracias, Lupita.
Gracias, señor.
Gracias. Who wants to go next? Ruben? Vamos ahora a recibir un reporte del Departamento de Policía.
Buenas tardes.
Tardes, Rubén.
Muy breve. Honorable alcalde y concilio, city manager. Queremos reportar que desde nuestra última junta del 22 de mayo no ha habido ninguna queja sobre el aumento de precio de nuestros negocios locales. Sí hemos tenido 4 reportes de funciones o convivencias grandes, pero todas han sido leves y entendieron que no podían continuar. 9 reportes se recibieron de personas no utilizando sus cubrebocas. Cada uno de ellos fue dado un lo que le llamamos un warning, una advertencia. Algunas personas no tenían máscaras y como los oficiales siempre traen máscaras extras, se les proporcionó una máscara o cubreboca. Uno de ellos, que fue un negocio local, se le dio una advertencia escrita, warning nomás, por no tener a sus empleados utilizando los cubrebocas. 3 llamadas fueron recibidas de personas que no están manteniendo distanciamiento social y una llamada que no fue cierta, fue de un negocio que no es esencial, seguía abierto. Las llamadas de violencia doméstica han tenido una baja comparada al mismo tiempo del año pasado. Fuera de eso, no se han recibido reportes de abuso hacia niños. Sí hemos puesto toda la información que se nos proporcionó por parte del condado en nuestras redes sociales para que las personas sepan cómo pueden reportar ese tipo de abuso. Y por ahorita es lo único que tenemos.
Robert, muchas gracias de nuevo por estar con nosotros. Chief Cesella.
Buenas tardes, señor alcalde y miembros del concilio. Le voy a dar un resumen más rápido que podamos aquí sobre la plática que hizo el comandante de bomberos. En sí, nos dio un reporte sobre un resumen, ¿verdad?, sobre la reapertura en fases que comenzó el 1 de mayo de este año. En sí, en estos momentos, una colaboración entre profesionales de la salud y miembros de la ciudad del Centro. Fue basado en información y datos que se proporcionaron aparte de los grupos de epidemiología del Departamento de Salud Pública. En sí, lo que estábamos viendo en aquel entonces era la capacidad del sistema de atención médica para tratar a los pacientes. Incluso incluía el número de camas disponibles en nuestros hospitales locales. La información y datos incluía... La información y los datos incluían la capacidad del hospital, incluyendo la área de cuidados intensivos. Le dimos seguimiento o en sí se incluía información sobre seguimiento de contactos. Eso se hace por parte del Departamento de Salud Pública. Eso ayuda a profundizar en las condiciones locales. También nos deja ver qué está contribuyendo a la propagación del virus local, qué es lo que está ocurriendo aquí en sí. Y nos provee un poco de transparencia, ¿verdad?, sobre la información y los datos, que nos permite enfocar nuestros esfuerzos y recursos en las áreas que sean necesarias. Por ejemplo, esta es una vista de lo que viene siendo el dashboard, o viene siendo la página, ¿verdad?, donde el Departamento de Salud y el Condado Imperial agregan la información y nos enseña, por ejemplo, aquí lo que viene siendo el promedio de 7 días y un porcentaje de cambio. Esta toma nos enseña lo que viene siendo la estabilidad epidemiológica, el número de casos que se están viendo aquí en el Valle Imperial. En sí, hemos estado viendo que, por ejemplo, el gobernador reportó que había un 23% de casos positivos en el Valle Imperial. Esa información nosotros creemos que fue basada en información ya antigua, ¿verdad?, vieja, de hasta 2 semanas. Lo que hemos notado nosotros, tomando información del sitio de web del Departamento de Salud Pública, es que a lo más alto que hemos visto es un 18%, que fue la semana del 10 al 16 de junio, y en la semana del 16 al 22 estamos viendo que el porcentaje ha bajado hasta 14%. En sí, recientemente, que viene siendo el 29 de junio, el Condado de Imperial, por parte de su Oficina de Información Pública, mandó un comunicado de prensa en donde nos hacían saber a los ciudadanos, al igual a los miembros del concilio y también equipos de manejo de las ciudades, que en sí estaban respondiendo a lo que el gobernador había propuesto en en una rueda de prensa que tuvo ese día, anteriormente a como mediodía. Y en sí, el comunicado de prensa, ¿verdad? Que ponía en sí unos puntos que el condado quería seguir para tratar de ayudar la situación en la cual nos encontramos. Y en sí era reiterar la orden de permanecer en casa, en la cual nos dice que continúa en efecto y que los requisitos de cubreboca también continúan en efecto aquí en el Valle Imperial. Alentaba a las empresas a hacer los cumplimientos de los requisitos de cubrebocas, el cierre de negocios no esenciales, la compra en tiendas, por ejemplo, ya que vendría siendo no solamente recoger en la acera o en el estacionamiento como curbside pickup, y aumenta la actividad educativa sobre restaurantes, aclararon más que es solamente curbside pickup o el recoger en la acera o en el estacionamiento la comida, y alienta a las familias a limitar el número de personas que visitan en una tienda. Por ejemplo, si iban a ir a comprar víveres a Walmart, que solamente una persona afuera. Continuamos con, nos recuerdan que sería bueno prohibir reuniones no esenciales de cualquier tamaño, continuar alentando a las organizaciones religiosas a que realicen los servicios religiosos virtualmente y prohibir servicios en los recintos, ¿verdad? Y tratar de tenerlos en lugares exteriores a como sea posible, limitando el número de participantes a 100 solamente. Y mientras puedan implementar medidas de distanciamiento social. Al igual que el condado piensa fomentar los servicios de teletrabajo, pues nos hacen ese recuerdo que sería mejor que si es posible las empresas, ¿verdad?, dejen que sus empleados trabajen desde casa, el cierre al público de todos los parques y áreas recreativas, al igual alentando a las ciudades a cerrar sus parques y áreas al igual recreativas. También uno de los puntos dice que desean continuar colaborando y aumentar el compromiso entre las ciudades y las agencias para la aplicación de la ley, en caso o en respecto a las órdenes de salubridad pública que se puedan enforzar por la ley. Participación cívica de organizaciones comunitarias y grupos religiosos en un plan de información pública para ayudar a pasar la información y continuar la colaboración binacional con la ciudad de Mexicali para ayudar a mitigar los impactos de COVID-19 en ambas comunidades. Y en sí también tenemos información sobre lo que el condado desea mencionar. Estoy un poquito perdido, disculpas.
Está bien.
Tengo mi perrito en el hospital ahorita. El condado de Imperial espera una respuesta del Estado. Sin embargo, mientras esperan esa respuesta, el condado ha comenzado a implementar algunas formas independientes de mitigación, colaborando con la ciudad y el Estado, al igual que piensan mandar otro oficio de salud pública en el cual actualizan la orden de salud que el doctor Stephen Monday había enforzado anteriormente. Al igual, en lo que viene siendo el presidente de la mesa directiva y supervisor del Distrito 2, Luis Pancarte, comunica que él espera, la verdad, que como junta de supervisores del condado, ellos están comprometidos a adoptar medidas adicionales para disminuir los impactos de COVID-19, al igual que pide a todos los cuerpos gubernamentales de nuestro condado que aumenten la participación en sus comunidades para ayudarnos a mejorar la salud y la seguridad de nuestros residentes. Y aquí vemos lo que viene siendo una gráfica que se encuentra en el sitio o la página de internet del estado, viene siendo parte del mapa del estado, y en esta gráfica nos recuerda, ¿verdad?, que estamos en la etapa 2 de lugares de trabajo de bajo riesgo. Es posible que le pongan reversa a esa etapa y que regresemos a una etapa anterior. Lo que sí es seguro es de que no vamos a continuar hacia adelante en este momento. Y en sí, la etapa 2 lugares de trabajo de bajo riesgo continúan siendo lugares, por ejemplo, de fabricación, minoristas, oficinas, en particular en las cuales no se puede hacer el teletrabajo, museos al aire libre, servicios personales limitados. Al igual, el 26 de mayo se emitió una guía para iglesias basada sobre la guía del Departamento de Salud Pública del Estado de California y que fue aprobada por el oficial de salud del condado, el cual requiere modificaciones de 25% del número de personas que pueden asistir a un servicio en una iglesia o 100 personas, dependiendo cuál número sea el menor. Y puede ser reevaluado y modificado por el oficial de salud al igual. Comercios al por menor, eso se permitió a partir del 26 de mayo, también basado sobre reglamentos que se encuentran publicados por el Departamento de Salud Pública de California, con la colaboración del oficial de salud local. Pueden al igual ser reevaluados y modificados por el oficial de salud. Y la orden de quedar en casa, como lo mencionamos anteriormente, se mantiene en vigencia y permite que si hay personas que pueden trabajar, en particular esas que trabajan en áreas esenciales, pueden asistir a sus trabajos, si se pueden hacer compras locales, otros mandatos permitidos por lo que viene siendo el oficial de salud pública. Los comedores en restaurantes y cuidados personal no han sido autorizados en el condado de Imperial, al igual que los siguientes servicios como salones de bellezas, barberías, salones de servicios de uñas. Se espera que los siguientes pasos sean el esperar actualización del oficial de salud pública del condado de Imperial, el potencial de intervención del Estado. Eso fue algo que el gobernador mencionó en su rueda de prensa. Y se sugiere que aclaremos lo que viene siendo información y datos que se están recaudando por el área de epidemiología y continuar campañas de información pública para la protección de la salud. En sí, existen varias fuentes de información que se pueden encontrar en Internet, al igual que la línea de información de la ciudad del Centro en el 760-337-4035.
Derrick, de nuevo, reporte extraordinario. Muchísimas gracias por tomar el tiempo y traducir el reporte del Chief Herbert. Gracias, Derrick. Con esto concluimos la junta en español. That concludes our open session meeting. Do I have a motion to go into closed session, please?
So moved to
I
go
have
into
a
closed
motion by Oliva, second by Garcia. All in favor?
Aye.
Yes, so let's go ahead and move to closed session, please.